anthropology involves getting very close to things, and that sort of that participation, involvement. But in order to make sense of what's happening, it involves also standing back at great distance. So this is about CAMHRA, right? The Center for Anthropology and Mental Health Research in Action.
Yeah.
And why CAMHRA? Why do we want to bring anthropology and mental health together?
How is it?
Yeah, it's interesting, isn't it, David? Because, you know, I suppose I've come to anthropology and mental health right at the beginning of my career.
Yeah.
Whereas, you know, and I've come to that because of a set of encounters that I had with completely different people. And you've come to anthropology and mental health at the end. I don't want to say the end, but a mature moment in your career where you have, you know, a wealth of experience and wisdom to bring to what is a very complex issue. So maybe we can start there with, you know, what are those encounters?
Well, it's an interesting and story, because I think some things in careers happen through that kind of progression, and some things through rupture.
Yeah.
And for me, it was rupture, a crisis event, in a mental health crisis event in my family, and funnily enough, it threw me into unknown territory, an unknown world. And among the resources that I had to try and make sense of this new unknown world were partly thinking about the world as an anthropologist. You experience states that seem a bit like possession states. And so I was recalling what some of my own field work, which back in the 1980s had involved working with in a shrine in a place where people had gone for healing, and particularly for the exorcism of spirits. But it took a while for me to bring anthropology to bear on understanding personal life and mental health challenges and mental health crisis in my family. But I began by thinking, actually, anthropology was somehow, in a career in anthropology, we become equipped with a capacity almost to stand outside and see what's going on from another point of view, to observe myself, to observe ourselves, to have that position of going through something, but also reflecting on what it is we're going through. There's this kind of self-ethnographic point of view. So I think anthropology provided a wider repertoire of ways of thinking about unusual experiences because of other ways of thinking, other encounters I'd had, but also a way of standing outside those experiences, which turned out to be kind of therapeutic.
So what do you think that the potential, you know, that kind of deep relational potential of anthropology or ethnography is, kind of speaking back to other disciplines like in the sciences or public health?
I think one thing that I guess it's at the heart of anthropology, and it's part of what you've talked about in your work as well, is coming to know about something by being a part of it. And it's trying to go back to the sciences thing. Many of the approaches that we're familiar with in research are about testing an idea, having a hypothesis, working within a given framework to decide, you know, is what we assume to be the case or not. So testing things. So I think what ethnography involves, and I don't know if you'd agree with this, is actually trying to shift away from the prevailing framework of understanding a phenomenon. So I'm shifting away from a psychiatric framework to understand things towards another kind of framework. Now, none of us can observe and experience the world unmediated, without frameworks. So we're often quite deliberate in shifting alternative ways of framing problems. But I think that openness to different perspectives on something, and that curiosity to find out what things would look like if we asked different kinds of questions. So maybe the key thing is discovering what the questions to ask are, rather than finding the answers to given questions.
Yeah,
I don't know,
assuming what the questions are, right?
I mean, how does that, if we turn that back into your work, how does that?
Absolutely. I mean, I think I really learned about this when I was doing a little bit of work with Professor Laura Baer during COVID. And I just come back from my field site. I was writing up my PhD dissertation, and Laura was asked to be on SAGE by B, the government advisory board on COVID after the pandemic had just broken out. And, you know, together we built a team of researchers who and all anthropologists, and our aim was really to understand how government policies around COVID, you know, social distancing, furlough, etc., were generating or exacerbating forms of inequality in the UK. And what was really interesting is that suddenly anthropological knowledge was really helpful to public health professionals in that moment, because the way people were behaving couldn't be predicted, you know, by behavioral scientists or by economists. So suddenly this kind of real-time knowledge of how inequality was working became really valuable to the implementation of policy, the design of new policies, the, for example, around engaging certain groups in vaccine uptake, or in understanding the mental health challenges that people were experiencing as a result of social isolation. So this kind of real-time ethnographic knowledge, you know, this kind of deep social listening that was made possible by anthropological work was really valuable to mental health professionals and to public health professionals in general.
Especially when you're facing something that is unknown, or an innovation that you're trying, when the things are changing fast. And that's where that feedback of learning from things as they unfold
is really
may
crucial.
be particularly helpful, and something that embedded anthropologists can provide. That's interesting, because I mean, you've raised this question about the use of anthropological knowledge and how I sometimes think that anthropologists are accused of not being able to generalize.
Right.
So in a sense, we can't, as economists and others can do, generate knowledge that is predictive, in a sense, because it's based on understanding the mechanisms or the mechanics of a social or other kinds of process. So we know what's going to happen in the future because we've understood it. But actually, anthropology may not be very good at, ethnography may not be very good at generalizing across space, but we are actually probably best at generating to practice, because the practice in any given instance is so complex, and there are so many variables and so many things that are contingent that need to be thought about. Just as you've explained, you learn about that complexity in one context, and therefore you're equipped to be able to ask questions in a different context. Maybe the same set of ideas, the same principles, the same values, the same thing you want to try in a different area, but you know it's going to be different, but you've got that capacity to learn and adapt. And actually that capacity to develop the means for putting things into practice in different settings is enormously important.
That, you know, there's a turn in anthropological thinking to really think carefully about who's producing what kind of knowledge for whom. And I think anthropological history is marred by, you know, a kind of colonial legacy that suggests that there are epistemic hierarchies of who gets to produce the knowledge about what and about who. And I think, you know, as a discipline, we've done a lot of thinking and kind of we've dug up our own assumptions and so I feel really privileged to enter the discipline now, you know, in a moment where it's really normal, in fact, it's encouraged to build coming back to this word co-production, you know, co-produced equal relationships with our interlocutors, you know, with those who we used to study. and to think about ourselves as well as objects of study, and our own worlds as objects of study. But I think that process of working out what is that standing with, you know, I think to use Kim Tallbear's words, what does it mean to stand with someone as you kind of generate knowledge or different perspectives, as you generate ethnography, is something that's always shifting and changing. And, you know, I used to feel like, oh, you know, what can I actually contribute? Shouldn't I just give the tools to my interlocutors to create things about their own lives? But the more the more deeply I've worked with particular people or communities, the more I've realized, well, there is something about this ability to stand back, the ability to hold a conversation that people maybe wouldn't otherwise be able to have, that is valuable about anthropology.
Anthropology involves getting very close to things, and that sort of that participation, involvement. But in order to make sense of what's happening, it involves also standing back at great distance to see the other things that are going on. But the difference between being in the flow of something and standing back and thinking about it anthropologically is enormous. I've experienced that having worked for a long periods of time in development organizations, on development projects, in the flow of it, and then stopping and thinking and reflecting and writing and coming to a different perception. What do you think mental health professionals or people in the world of mental health can gain or get from their interactions with anthropologists or from anthropology? That is one of the things we're hoping our centre will do.
Yeah, absolutely. I mean, one thing I was just so struck by in putting together, you know, the foundations of this centre is just how hungry mental health professionals, you know, whether they be therapists or psychiatrists or public health professionals, how hungry they were for different kinds of ethnographic knowledge. And I think that hunger comes from an appreciation of the fact that the frameworks that are being used in the sciences at the moment and the cultures of psychiatric and psychological medicine are not enough to meet the needs of London and global kind of mental health populations. And I think there's a hunger to understand what needs to change both within the structures of knowledge, the processes, the interventions, and about the world around them to adapt those to fit people's needs. So I suppose what they can really learn is how to embed ethnographic knowledge up and down the chain of mental health service provision. You know, what kinds of ethnographic knowledge can they learn within their medical degrees, you know, that help them to ask different clinical questions? How can they embed anthropologists in the teams that are designing their RCTs or designing their interventions? What kinds of understandings of social relationships are necessary to design better interventions? You know, what tools do they need on the ward to be able to remedy issues that result in readmission, for example? And this is such an important, like, very foundational observation of medical anthropology in general, right? That it's not only people in villages in India who have culture, it's also, you know, hospitals in central London. And, you know, as anthropologists, our role is to understand what are the relationships, the values, the processes that kind of make up that culture, and how do those affect the way in which people receive or respond to care? How are they interpolated into that culture, and what does that mean for them having to leave their other cultures behind, whether they're cultures of the family, of, you know, an ethnic group, etc. So I think it's really different to, you know, this kind of language that's used in mental health care about like cultural competency or you know, working with BAME communities or CALD communities. So it's not just like people with brown or black skin who have culture. It's also, you know, thinking about the culture within the institution itself. So I think it's about you know, it's a pretty ambitious aim, but we hope that mental health professionals might be able to embed ethnographic knowledge within their disciplines, within their kind of their own intellectual and clinical cultures, rather than just like having anthropologists on their team. You know, what do you think that anthropologists need to think about as they begin to deepen their ethnographic work on mental health?
I think there's a whole range of new opportunities that are thrown up by working in mental health care. And obviously there are loads of different contexts and different kinds of approaches are needed in different settings. But one thing that I've learned in my current work is the importance of working collaboratively. So in the work that I'm doing with the community mental health team, we have a group of anthropologists. But actually, well, we have a group of researchers, a group of ethnographic researchers, some of whom are anthropologists, some of whom are actually, there's a psychiatrist, a psychologist, a family therapist, and we have two, well, actually half of our small team are people who have lived experience of secondary mental health care services or have been, or carers. So working collaboratively and working as a team, and building into that team people who have lived experience of mental distress and the psychiatric system. I can't imagine doing this kind of research without pulling all of those different kinds of experience and positions into a team of researchers. Now that makes research complicated. Because the sole ethnographer going off, writing field notes, sitting back, interpreting bit as I was describing earlier on, and writing up articles is much more straightforward than having to negotiate relationships in the field with a team of people. But the richness that you get from those different perspectives and the kind of relationship building that's necessary, but also possible through having people who are in different positions, makes it much. It opens up lots of opportunities, and I think that it's. I think it's a challenge for anthropology to work collaboratively in that way, to work as teams, not just as individuals.
Absolutely. I think for me, that curiosity, you know, what CAMHRA can ask of the world is, how can we recenter a question of inequality in who absorbs the distress of life and change and society? Whether that's a question of racial inequality, gendered inequality, sexual inequality, caste inequality, you know, the question of who holds distress in our society is one that is critical to answer if we're going to build better mental health systems.
Yeah.